Welcome. I'm Kathy Calvin. I'm President and CEO of the United Nations Foundation, 20 years old this year, and I'm joining Seth Berkley, who is the CEO of Gavi, which is the Global Vaccine Alliance, which is 18 years old this year, which is a significant thing I want to say because sometimes people forget how much progress has been made in the last 18 to 20 years in reducing poverty, extending lives, finding new ways to keep babies alive, and yet we have so much more work to do. I know you have a midterm review coming, but Seth, talk a little bit about what progress you think the world has seen because we are now able to reach and vaccinate so many children, but what else has to be done?
So thank you, Kathy, and it is extraordinary progress. We have right now the lowest level of absolute poverty in history, and that has been the big story. People forget that when they talk about all the problems. But also in our area, we have now the highest level of immunization in history. Today, 86% of children in the world get at least 3 doses of the diphtheria, pertussis, tetanus vaccine. That's the vaccine we use as a tracer. Now, of course, that means that 14% do not. And this is important. That 15 million children who are under-immunized, of course, are in fragile zones, in places that are stigmatized populations, in urban slums, and so it's very important we reach them. But one of the results of this amazing increase in immunization has been that we now see child death rates almost halved since the beginning of this period. So this is extraordinary progress. Still 5.5 million children die a year unnecessarily, and of course we have to do better on that, but it is a huge amount of progress.
Yeah, you for a while talked about that one child in 5 that was not getting the vaccination he or she deserved, and we know moms, we talk to moms in this country, and they really believe a child anywhere in the world should have the right to a vaccine. What are you using now to find those children, and how can technology be helping with this job?
Well, what's interesting is that the easy stuff has been done. And so, right now it's routinized for the people that are easy to reach. What we have left with are these difficult areas, and they're changing. It used to be that 90% of poor people lived in poor countries with poor healthcare systems. Much easier. Today we have a large percentage, about 70% of under-immunized kids are living in middle-income countries. We have a record amount of urbanization, more than 50% of the world's population is living in cities. So the challenge is, how do we reach these children in a changing world? And one important tool that can make a difference is the common cell phone and the availability of digital technology. We have more cell phones today than we have toilets in the world. And so the challenge is to take those and use those to help identify both where people are being missed, but then also to be able to track them to make sure they get immunization services, but also other primary healthcare services.
So it's not just making sure there's a vaccine, it's actually making sure there's a system to get there, and even identifying where those children are. Are they getting registered at birth? Is that another use of the cell phone to identify where these targets are that we need to make sure we reach?
What's interesting is that people think that, oh, that's a simple thing. But today, 1/3 of all children in the world are not registered. So this is a big problem. In fact, there's an SDG goal, 16.9, to by 2030 have every person in the world registered. So this is something that is obtainable. But when you talk about vital registration, we think about birth certificates, death certificates, marriage certificates. The single most commonly used vital registration is a child health card. And about 95% of kids get a child health card at some point in their lives, but they're not linked to the vital registration system. And so if that parent keeps that card, it's a great record, but if they lose it, it's gone. And so the challenge is, how do we digitalize that? How do we connect it to the birth system? How do we create digital identity so when people are displaced, they can then be able to be tracked and be able to help if they move to a different location or a different country?
So how are you doing with funding? This must be one of the great challenges. It's a generous world, but there's a lot going on in this world that's difficult and challenging. We've got conflicts and crises, we've got environmental issues. What's your story? What's your case for why we've got to keep funding this vaccination drive?
Well, first of all, I want to thank the UN Foundation for their support of Shot at Life, which has been a contributor to the work we do through the population and getting that message out there. I mean, obviously, at the end of the day, if you don't have your health, you don't have anything. And investments in vaccine are the most cost-effective interventions in health. For every dollar you invest, there's a $44 return.
Wow.
So this is a great investment. The challenge, of course, is that it's more expensive to reach the unreached, but we need to think of it not just as vaccination, because that population is the critical population that's missed. And if they're not getting vaccines, they're not getting anything. They're not getting contraceptives, they're not getting interventions for safe motherhood or vitamins or any of the other interventions. So as we think about a world with universal health coverage, the first thing that's critical is primary health care, which is the basic intervention, and then the building block of primary health care is immunization. So that 14% that's being missed, if we can give them basic immunization, vaccines don't deliver themselves, that means a health worker, a supply chain, a surveillance system. With that, we will be delivering the service they need to be healthy, to be well educated, to be able to live out to their full potential. And that, after all, is all of our goals.
Well, you've been at this for 7 years. What are your biggest lessons that we all could take on so that we make sure we reach our goals by 2030 of getting those 15.5 million children in the system, fully vaccinated? What should all of us be doing? I mean, I don't run Gavi, you do, but there are plenty of us who could be doing something.
Well, I mean, I think one of this is to focus on measurable results. It is critical that we have a process to learn constantly, because things change, problems change. There are different challenges in front of us. Today, we have to deal with global warming and climate change, which is affecting the way vectors exist, the way diseases are being spread. We have more displaced people in history. These are all challenges that we need to adapt to. So for me, it's about having good data, it's about being focused, it's about constantly learning and using those lessons to improve delivery. And lastly, it's about political commitment. Nobody you talk to is against trying to save the children. It is the next generation. The challenge is to get it on their agenda and to keep talking about it, and that's what we have to do.
Well, thank you for what you're doing. It's amazing to watch it happen. We're proud to be partners. We've been glad that we can help support it here in the U.S., but also globally. And I know here we are at the UN, and a lot is happening this week. I think tomorrow you're going to talk about pandemics and some of the other challenges that we are all facing. So can you give us just a little bit of preview about how the week looks for you and what you think we might want to watch coming out of it?
I think this is an important week. On the health side, there's going to be discussions on non-communicable diseases, which for us is there are now vaccines for at least 2 major cancers and trying to get those out. It's also a very important week, the first high-level meeting on tuberculosis, the infectious disease that today kills more people than any other and has challenges with antimicrobial resistance. So these are 2 important things to look at. We live in a world that has more epidemics than ever in history, and those epidemics are now accelerating because of the density of population and because of the changes that are occurring. And so how do we control those and deal with those? These are some of the challenges we have to think about. But lastly, of course, at the end of the day, good governance and peace is critical to what we do if we want to build a safe and better world. And although that is not my job or even your job, it is the base to everything we do. And so we have to keep that in mind as the UN and others work to try to make the world a safer and more peaceful place.
Seth Berkley, thank you so much for what you do, and have a great week.
Thank you, Kathy, for all that you do, and we look forward to continuing to talk.
Great, thanks.